بسم الله الرحمن الرحيم. أحب أرحب بحضراتكم في الويبينار الخاص بالبورج سكان والبورج لاب. أنا دكتور أحمد وفي، أستاذ الأشعة في القصر العيني ورئيس البورج سكان. البورج سكان هو ريلاتيفلي نيو براند، مركز أشعة متكامل بقالنا حوالي سنة ونص في الماركت. بنشتغل ان كولابوريشن مع معامل البورج كوان ستوب شوب. عندنا دلوقتي فرعين كبار في القاهرة، وعندنا خطة طموحة للنمو والتوسع داخل وخارج القاهرة إن شاء الله. إحنا الحمد لله بنمتلك أحدث أجهزة الأشعة من شركة سيمنز، وبنحتفل الأيام دي بدخول خدمة جديدة في مراكزنا، وهي خدمة فحص البات تي اللي إن شاء الله هيكون متوفر في آخر الشهر ده إن شاء الله. أحب طبعا أشكر في البداية شركة سيمنز اور بارتنر على المجهود اللي عملوه معانا في التحضير لهذا الويبينار، واحب اشكر طبعا التو سبيكرز اللي هيشرفونا النهارده من شركه سيمنز. واحب اقول لحضراتكم ان ممكن اي حد من الحضور يقدر يكتب السؤال بتاعه في الايكونز اللي تحت الشاشه، واحنا هنجاوب على اسئله حضراتكم في اخر السيشن ان شاء الله. It honors me to introduce our two speakers today. The first speaker is Kuni Kolakal. He is the CT Clinical Marketing Manager Siemens in the Middle East. Is the ultrasound we will start and then COVID-19. When you can start.
Assalamu alaikum all. I urge everybody to, as a ground rule, to mute your mobile and devices. That will help us to give a better way to do this webinar. And let me introduce myself. My name is Kuni Muhammad, and I'm taking care of CT clinical marketing and collaboration support in the region. And first of all, I'm just switching off my video because to get a better bandwidth. And at the end of the session, we can have questionnaires and everything we can discuss whatever we are seeing throughout the presentation. And once again, Assalamu alaikum and a warm evening for you. I want to thank all of you as a frontline fighters in this COVID-19 pandemic, and you are the guys, the heroes in front of us fighting against this. And this is a privilege for me to show a clinical experience throughout the world what Siemens done against fighting the COVID-19, and it is my privilege to show to this presentation to you. And once again, thanking you for all your support and Alborg Scan to conduct such CT webcast where it is helpful for the humanity. To continue that, I just going to my next slide. You know this dashboard in World Health Organization. So today, just now, before I starting this presentation, I copied this from the World Health Organization dashboard. You can see that the new cases for today, and even the Egypt, today 2 new cases are 1,025. And it's keep on increasing, and even a lot of studies are showing that this is going to be a pandemic with us another 1 or 2 years, maybe some more years of variation of this viruses and all that. So we are still fighting against this, and there are a lot of stories coming out throughout the world. There are a lot of best practices, best way to tackle the situation. So through our Go technology, how we tackle this with a CT scan, I just want to explain you throughout this scanner, this presentation. So here, if you look at this presentation, so there is one story from India. I can tell you, even there are a lot of migrant workers came back to one of the rural villages of India, where there is no PCR test or any other test are available. So what they have done, they just there is a scan center. They conducted 150 migrated the return back workers, and they are asymptomatic, and it is turned out to be 73 of them are positive. So like this, there are a lot of clinical evidence where the CT is playing a vital role in COVID-19 detection and prognosis and other stuff. So I'm coming for that also, and there are hundreds of papers are came, even artificial intelligence algorithm and other kind of the new modern technologies are came to this field. Even if you look, even if you just Google it, you can find out more than 200 to 300 papers on COVID right now. And it is dynamically evaluated, and every day it is changing, even like COVID detection to the COVID prognosis and the treatment planning, everything is changing day by day. But every day CT role is same, and CT have a vital role in COVID-19 detection and prognosis. So where are the CT role actually? Let me show you a short video where the CT is actually helping in COVID-19 pathway. So if you look at the pathway of a COVID-19 patient, so it is diagnosis, even if it is asymptomatic or symptomatic, then the prognosis to therapy, how much it is effective, and then the follow-up side where you have to do multiple scans in a short period of time. And the sensitivity, as you all are aware about that, it is 91 to 97% the CT scan are sensitive to get a better result for COVID-19 detection and prognosis and therapy. So, but at the same time, there are challenges too. So we have to be careful with that challenges, and we need technology to overcome that challenges. Even the radiologists are suffering, even radiographers are suffering. So we need a solution for that. So what is the solution we have? So the operation and the clinical challenges for COVID-19, especially the workforce exposure to the disease. That is one of the major challenge. Once you expose to this disease, then you are forced to go for a quarantine for 18 to 23 days. Then you have to be negative and come back and work. And the workforce is get exposed means it is a really burden to that institute. At the same time, number of workforce is required. How many people need for this patient positioning and other kind of problems, patient positioning and related complications. The other one, it is the patient dose, multiple scan in a short period of time. So it's one of the real challenge where the scanning is happening in a very short span of time, maybe 2 to 3 to 4 scans in 1 month. So it is one of the other challenge. At the same time, if the operational experience, even the people are changed in different shift, and how much even senior radiographer give better image quality, junior. So there is an inconsistency there. So we need proper result for the reporting and for the clinician to take a decision on the patient. And the other one, it is continuous real-time patient monitoring while doing the scanning and after the scanning. Optimum data for the reporting, image quality is one of the major factor. So for the radiologist and the physician who is taking the decision, so everybody should get better result. So, and other than that, COVID beyond there are a lot of complications are now reporting. There is not only just imaging, there are vascular imaging incorporated with this, because as of today, we are treating the disease rather than the virus. So there are a lot of much complications like liver failure, kidney failure, and vascular abnormalities, and everything is coming into the picture. So the CT scanner or the system supposed to be equipped with to manage that kind of patient too. So how we can tackle this situation? So what we have done, we introduced the new Go technologies, where actually this technology we developed, where for the patient preparation to quality check to processing and viewing concept. And the real idea for this technology, you have to be more close to the patient. So for that, we find out a solution for mobile solution actually, but that turns out to be a favor for us. Now this mobile solution allow us to away from the patient in terms of COVID detection. So how it will be helpful? Let me show you a short video of Go technology, how it is helping to the technologist and the patient and the radiologist.
Go Ferments. With trend-setting workflows, experience a new way to operate the scanner, thanks to the new mobile workflow of the Somatom Go platform. At the door, patient admission via tablet. Quick positioning without leaving the patient. Mobile scan setup for all routine scans. Flexibility in workstation placement, even in the same room. And a remote scan start, while keeping a close eye on patients with a camera integrated in the front cover. A whole new way of operating the scanner for greater mobility, flexibility, and patient proximity. Go for high performance with trend-setting workflows.
As you see now, you can do almost everything mobile. So you are not even such kind of patients if you don't want to go inside. So you can do everything in your hand. And moreover that, we introduced a new features on this tablet where you can save this height and position. So if it is, you save that positions. So next time patient come, even if it is an asymptomatic patient, he can walk. If he lay down on the table, you just press A, it will automatically go to that position. Or another position, if you can set as a B, you can go to that position. So whereas depends upon the patient size, you can set 2 positions and it is automatically position the patient to the gantry. And in that way, you can actually work very effectively for such kind of a situation. So normally we need to be more close to the patient. At this situation, we have to be a little bit away from the patient. So that's the standard now. So if you go furthermore, one of the major thing nowadays, you can see that it is an asymptomatic patient. So CT imaging in an asymptomatic cases with COVID-19, you can see that patients are really doesn't have any disease, nothing, but they have that. So CT is one of the major tool to get to know this one. And in that kind of patient, the main I can show you another example with that. So what we need an asymptomatic patients, mainly what one, it is a faster scanner, and at the same time it's supposed to be very low dose. So where we have a tin filter, I will come to that in the later. So you can do screening of a SARS-CoV patients, very minimal dose. If you look at this scan, now you see this, the dose level here. You just see the dose level here, 51 milligray. That means if you do one AP lateral and oblique X-ray, that is more than 51 milligray. But if you do this three-dimensional CT scanner, you can precisely see what it is happening inside, and three-dimensionally you can see, and you can decide what is the next step for that patient. Compared to the X-ray, this is far, far better to give the details to you at the same quality, and the dose level is very, very minimal. For the screening kind of patients, that is more important to reduce the dose. Maybe he have, maybe he don't have. So better to be in a low dose mode. At the same time, if you go further, in this part of the world, you know that there are a lot of image artifact problems. That's where this artificial intelligence algorithm made a lot of difference. So if you see this, a metal is detected, and you know that this region is more sensitive, especially for the ladies and other kind of old age women, where if you instruct them, but they don't follow most of the time. And if they follow, sometimes we can teach them that just to remove your chain and all, but most of the time, even technologists fail on that. So here the artificial intelligence come. Once it is there, and if they are not removed, it will automatically detect and tell you that there is a metal. So please remove it. So a classical example for a COVID patient came. Now you see that she have a chain and she didn't remove, and the system detected that, and we asked them to put it up, and we finished the scan, and there is no artifact from the metal. So that is what we meant for. So we don't want to repeat the scan, we get the better image quality in that way. So artificial intelligence is allowing us here to reduce the mistakes and reduce the artifact in this one. So it will help you to guide you throughout your scan, how to perform a better scan. So in the prognosis side also, if you go, there are a lot more artificial intelligence algorithms are coming. So what we have done, we have a lot of scanning happening around the world. Why can't we take that as a neural algorithm learning? So we took almost 180,000 log scan entries, and we evaluated that, and we analyzed by AI and exported, and we put that into the CT scanner. So what it will do actually, it throughout your path of scanning and method, so it will help you to reduce your mistake throughout the scanning. So everybody gets same image quality, every technology will be activated without knowing, or with some commands. So let me give you a small example on that. So if a patient come with a breath hold possible with a 5 second, another patient, if you check, he can't hold the breath below 5 seconds. So if you just choose one command above 5 seconds in the system, what the system will do, system will automatically convert the rotation time, pitch, and other factors to finish the scan as early as possible, below 5 seconds. And the same other patient, for the better image, better way to finish the scan, so it will be adjust the parameters accordingly. So system will think what you need. So you just have to give a command to the system. So another, even in that way also, another way, you know that the COVID-19 patient nowadays, the vascular abnormalities also major issues. So there are a lot of scan came out that the PE embolism and pulmonary embolisms are also a major factor here, and there are a lot of studies are happening on this. So this is one of the example of a pulmonary angio where they have done a suspected COVID patient. And this is one example, and vascular abnormality for head neck to down. And another one example for the related complications, they are looking for the whole body, then multi-phase angios also possible in that way. So the technology is not limited only for COVID. So it is beyond the COVID, it is always ready to support you. So that's what I want to emphasize you here. And if you go further, as I told that it is keep on helping throughout the path of the COVID and above that. So there is another artificial intelligence algorithm in the system where it will, in the CT scanners, it will help you to check and go. What it is mean for check and go. So even you know that we have a n number of patients, we position, we do the scanning, sometimes patient move on the table, sometimes you misplan it. So what the system can do for you? So once you finish the scanning, the system will check your image quality. So suppose the scan, if you see here, you just cut the costophenic angle or just the down of length is maybe a one or two slices in the down, there may be a pleural effusion, but you cut in that scan. So the system will automatically check this and will tell you your coverage is wrong. Do you want to repeat the scan? So either you can repeat the scan only that area and you can cover the full, or the same way you are done an angio and the contrast is not reaching that area, and then you can immediately repeat that scan. So maybe an extravasation, some mistake, so the vessel is not filled with contrast, then you can immediately repeat the scan. So this way, the system will always check the quality of the image and will intimate you, do you want to do proper way or you want to continue the way what you have done. So it will always intimate you. So one of the example, another one with the COVID, with the oxygen support, 55 years, prognosis side. Another example for pneumothorax. And at the same time, we can generate a three-dimensional volume images where it will be really helpful for the physicians to have a visual impact on what is happening inside of the body. So we can really give a better image quality to the referring physicians and who is actually treating the patient. Another classical example for a male patient with a COVID 1 mm MPR and the 3D of the same patient. Now it's an holography 3D, so this is also possible with the CT scanners. If you go to the follow-up, the furthermore, that's where we actually suffer a lot. Because if you see this one scan, it is start from 1/23/2020. Within 3 days, another scan. Within another 2 days, another one more scan. You see this prognosis and the treatment, then it is reducing. So another 1 month, one more scan, then another follow-up after the treatment. So a short period of time, a same patient getting a multiple number of scans. So that means an accumulated dose will be very, very huge. Here you can see that the severity score, it is 0, 1 then it is increased, then they get treated, and then it is going down to the score of 5. So a follow-up studies are really, really required sometimes in terms of COVID-19. So such cases, you are giving a huge radiation dose, very short period of time. So what is the solution for that? So what we have done, everybody have a filter in the X-ray. So with the patented technology, we add an additional filter called tin filter. So what the tin filter do, it will reduce the unwanted quanta from the radiation. So we conducted some study about that. Compared to the conventional CT, it is required 1/10 of the dose with the tin filter. So we don't limit this technology for any of our scanner. Whenever we invented this technology, we implemented this in all of our CT scanners. So the tin filter will allow you to do the low dose scans at the same time. Repeated scans, you can actually, it is a really good tool. And radiation exposure is a very, very major concern, especially for this pandemic situation. Also, we have to be very careful that with the radiation dose. So the tin filter technology will allow you to reduce the dose drastically, where you have to do 6 to 7 scans at the same dose. You can do 1 scan. So that is a clinician's goal there. So furthermore, my exam companion also will guide you. Even my exam companion is the artificial intelligence algorithm. Maybe the detection can, if you want to do a full dose, then this COVID-19 follow-up, if you click it, system will automatically activate the tin filter and reduce the dose accordingly. So you don't want to think too much. You just have to click what you want to do. So then the system will allow you to activate all this clinical pathways. So, and I can give you some classical examples on that. You see this tin filter study. So here, if you see this, DLP is just 33 milligram with a 1 mm MPR and BRT. So 33 milligram means 1 AP and lateral, if you take, that is 25 milligram. For this, here you are getting such low dose, a volume of data, and with very clear visualization. And I'm getting another example for the 3D of the same. Another example with the 51 milligram with a lady patient with breast and with huge fatty tissue. Still, we can use even obese patient also. We can really use this tin filter and effectively. You can see the patient size here, and the dose come around 57 milligram. That means a 4 X-ray dose. And the technology is not only for the COVID. So that is supposed to be help us beyond the COVID. I can give you a short example on that. If an AI, how it is working in a cardiac, you know that heartbeat will vary from patient to patient, and on the table, it will be really variable. So we give the beta blockers and everything at the same time to take a decision on according to the heart rate. Should I do a sequence, spiral, or bisegment? So the technologists have to think too much on this, or the radiologists have to be help the technologists to get the proper result. So what the cardiac expert do here, it's an algorithm run on the system, and it will check the patient heartbeat, and it will suggest you what you're supposed to do, what kind of scan you're supposed to do. So you don't want to be a very knowledgeable technologist or some to be a cardiologist to do the scanning. So the system will guide you. It is an irregular heart rate or regular heart rate, or how to do the scan, and it will automatically activate the protocols. So furthermore, if you go the key medical specialties that seek the help in, especially in with the CT, there are a lot of logis need this help from the CT. What they want to prepare the patient and to do a scanning reconstruction. They want to view the real images, the possible better images to the clinicians and the radiologists. So irrespective of the patient population, even if it is a kid or an RTA, or if it's an old lady or a cardiac or an obese patient, or if it is a COVID patient, irrespective of that, everybody need the proper image quality, and everybody need to be get treated same way. So Somatum Go technologies, along with artificial intelligent algorithm and the best image quality softwares and the COVID-19 thorax protocol, we can achieve all this in a short span of time. So you don't have to worry to make a decision making on what kind of patient you have, even if it is COVID or it's an RTA or an obese or a cardiac, even if it is a mummy or a horse, you can do a proper scanning on this one. With that, I will hand over the presentation to my colleague Nicolas. And if you have any question on this, we can answer all the questions at the end of the presentation. Thank you.
Thanks so much, Koni, for the presentation. Now we will move to the next speaker, Nicolas Jacou. He is the ultrasound segment manager, Siemens in Middle East and South and East Africa. His lecture title will be Basics of Lung Ultrasound regarding the recent technologies that will help in COVID-19 management.
Hi everyone. Can you hear me well?
Yeah.
And can you see my screen?
Yes.
Fantastic. Thank you for the introduction, and thank you for the previous presentation, Kuni. I'm also very happy to be able to present today and to be talking about ultrasound for the second part. We will leave the questions as well for the end, and I hope that we will have enough time to cover as much as possible. So from my side, so my name is Nicholas. I'm the ultrasound segment manager. I'm seated in Dubai as well, and I'm taking care of Middle East and Eastern Africa. And of course, we're all talking about the same subjects nowadays, and one of the important one in ultrasound is to know how is it possible to use ultrasound and what is the benefits and how to compare with CT, etc. So there's a lot of questions, of course, and I will try to be I will try to explain as good as possible all these details. So for the program, I will try to be as quick as my colleague Kuni. I'll just, of course, maybe I'll repeat a few things that were said before, but what do we know so far? What is the situation? How does ultrasound work, and is it helpful in the situation? So I will explain to you how it's very well recommended in ICU setup and in the bedside scanning for in-bed patients. Also, of course, we have to talk about, infection control. So I will explain a bit how it is done in ultrasound. And for the last two parts, I will explain a bit what Siemens Healthineers has tried to do to help the whole situation, and how we also have made some very, very dedicated website where you can find a lot of information, because for me personally, I think also it's important to know where to find good and accurate information, because of course there's the news, there's the YouTube videos, there's a lot of things going and easy to access, but sometimes the information is not so updated or not so true. So we've tried to put together as many trusted sources of information, where to find the numbers, where to find some from the European Society of Radiology, etc., where to find publications, ongoing technical and clinical papers. So this you will be able to know at the end of my presentation. So for the first part, what do we know so far? Actually, we don't know much. That's the big problem about it. And the only thing we know for sure is that we are all in this together. So we are learning thanks to you that are the frontline workers, frontline doctors. You're fighting this in the very front lines, yeah. And so we are learning a lot from you. We have almost every day some new information, but we still don't know very much how it's transmitted for sure, or how to cure it. Vaccines we talk about the vaccines, but it's not there yet, of course. And so at the end of the day, we're just trying as much as possible to go with the flow, but it's very, very difficult. The thing we know, how to find a patient as a COVID-19, of course, there's very clear clinical findings that are known: fever, continuous dry cough, sore throat, pneumonia, shortness of breath, and multi-organ failure are the few clinical findings that can tell for sure we're dealing with COVID-19. And what we know also is that to try not to catch it, that the recommendation are to wash your hands, wear masks, stay at home, or so isolate yourself socially, or if you can't, same as you or as us, we have to keep working in those tough situations. So we have to have the good protection, and that's the only thing we know for sure. When it comes to the topic of today from ultrasound, for me, just a few, like for 1 second, the reminder on how why ultrasound is actually very a good modality overall, is because we're talking about something that has no dose, that is extremely easy to use. So it's a plug and play device. You just need to find the plug, and even sometimes no plug needed. You just turn it on with the battery. And of course, it is expensive, but it's less expensive than X-ray, CT, MR, etc. So you will find it with higher availability. Technically, it's cheaper. So there's more of them in a hospital or in a clinic. It's always easier to find an ultrasound. So when we talk about the pathway, and this is exactly the same that was shown in the video in the previous presentation, I just took it just to show that, as you can see, ultrasound is there almost at every step. Of course, diagnosis, you can rely on the molecular lab tests, but when it comes to prognosis, when it comes to therapy, and especially follow-up, ultrasound can be considered and actually has a nice role to play. And the reason why is, of course, you will see very clearly, I will not tell that I'm better than CT or this kind of thing, but there's some very clear reasons why ultrasound is also a solid player in this time, is because it has, first of all, very good correlation with CT. That means that it's also able to detect coronavirus symptoms, and there's some very clear indication. It's as high as a CT almost in terms of sensitivity. And when it comes to bedsides, you know, sometimes CT isn't easily available. That's the first thing. Bedside ultrasounds, you go to the patient instead of the patient going to the machine. So you reduce the cross-contamination possibility, and it's also quite easy to clean when you compare it to a CT in a CT room. And of course, you're not just looking at the lungs, you're looking at, like, if you have an ICU patient, we were talking about organ failure, we were talking about vascular, you know, we have to check the vascular system, etc. And of course, this is one way to do is with ultrasound, especially when it's on the bed, especially when it's in an ICU. So those are very solid arguments for ultrasound. And when it comes to sterile environments, of course, I'm scared as well from, you know, going in a hospital, touching machines, meeting patients. And we've designed a machine in the past, and one we are still having today is called the Freestyle, for example, which is designed for sterile environment. So those systems can be completely, it's like a waterproof system. You can clean them in a very advanced way. You can even use them, since it's a cable-free system, you can use with the machine as even standing outside the room if you have a glass. So those things has been designed, not in mind that we would use it for COVID-19 one day, but since we have it, we're trying to make the best use of those kind of system. When it comes to the clinical side of the story, that's a bit of more information about lung ultrasonography. It's low cost, no dose. You can repeat the scan as many times as you want. There's no safety issues with this. And the thing is that all the findings are very clear. Yeah, so there's, as you can see on the image, typically there's 8 areas to scan. So both sides, of course, you have to duplicate this image on the left side of the patient, and sometimes 12 zone, because you can scan the back of the patient, but that's only if the patient can move, right? So if the patient cannot roll or cannot sit up, in ICU cases, it's not possible so many times. So that's it, you just don't do the back, but then you will have to go for 4 windows per side. So you have 8 zones, and you can look for your findings. And the findings, they're very clear, and I will show some images in the later slides, so for you to very clearly identify what they mean. So the pleura will look thickened and irregular. Yeah, so they call this a broken glass appearance. B lines, I will show very clearly what it means. B lines are more present than before. Confluence is when multiple B lines, they come together to make extra large B lines. I will show again some images. Consolidation is when the lung tissue is completely solidified, meaning it's almost looking like a liver or some kind of organ like this in the patient, instead of being looking like a lung. And you can find some effusions in some case. So let me show you. Before that, I just want to mention, because that's a question I have very often, how to acquire the images. And the beauty of lung ultrasound is that it's an extremely easy scan to do, and it can be done with almost any transducer. Of course, you would not go with a transvaginal probe, because that doesn't make sense. But if you look at the main free transducer that you find on almost every machines, on the markets. You will find a curved array, which is a convex transducer. This is the typical abdominal one you use for every patient. This one is very good because it has usually low frequency. It can penetrate quite nicely in the lungs. And so you see pretty much everything. The image quality is not bad. So it does the job. Phased array is usually the cardiac transducer, the echo transducer. There's a very small footprint, square style transducer. This one is also good. Why? Because it can fit between the ribs very nicely. So you will have nice penetration. You will have access, very easy access to the lungs. The only issue sometimes is that it's a low frequency, so you might not see the pleura lining in a good details. But still, if you're interested at looking inside the lungs themselves, this is very good. And the last one, almost every ultrasound has it, linear transducer. So those usually have higher frequencies, meaning that you have a higher resolution for the superficial areas. So if you're looking at the pleura, this is definitely the one you want to use. But as you can see, almost any transducer can do. So this is the beauty, is that you don't have to have a specific ultrasound for lung scanning. Pretty much all from portable to very high-end system, they can do it. So when we talk about A lines, you will hear this a lot in a lung scanning. Basically, lungs, technically, you cannot scan lungs in ultrasound. It's full of air, so it's absorbing all the ultrasound. There's no echo, there's only noise. And the artifacts that are created on this image that you can see is called A lines. They are parallel, and they're like, you can see that they're very strong, and they're like repeating. It's like just an artifact from the pleura. So this here is the rib, which makes a nice shadow because it's a bone you can't see behind. There's a second rib on this side, and in between the pleura is making some strong reverberation echo. So basically this is just noise and artifact. Now, if you start seeing such things as a B line, which is opposite direction, is a vertical B line, this means that suddenly there's echo, there's signal coming from the lungs. And usually this is a bad sign because there's not supposed to be any echo. That's usually meaning there's more like fluid, or there's infection, or there's something going on in there, okay? So it's an indication of lung interstitial syndrome. They're much brighter, and they completely override the A lines. So if you don't see the A lines anymore, usually it's a bad sign. And you can see in linear transducer how it looks, a bit higher resolution, but you still have the same effect of seeing deep in the lungs, or in convex, where you have multiple intercostal spaces, and you can see multiple B lines together, okay? So together with some doctors in Germany, etc., we actually created a very simple poster. So it's like a poster like you can put in your room, but it's also it can be used as just a reminder on your phone or something on how is the lungs looking at the different stages. Okay, so when the disease progress, so there's some images that have been put together, and I will show you this document right after, where you can clearly identify what it looks like normal lung. Okay, when there's early pneumonia, where you see those B lines start to come. When there's a moderate pneumonia, when you see the B line suddenly become very, very, there's a lot, yeah? And you can start seeing the border of the pleura is not so nice anymore. It's not a nice line. It starts to be completely irregular. And at the end, severe pneumonia, it's almost looking like an organ, like, if you're looking at the liver, or if you're looking at the spleen, it will look like an organ like this. So it's full. It's like it's very strong ecotexture, tissue-like ecotexture, they call it. So this is a very, very bad sign. And this is what the document looks like. It's very nicely done. It's official document. You can find it and you can download it right now on our website. And it's really showing what it looks like in the different stages. So just a bit zoomed in, healthy lungs, A lines, and you see it with convex. You see the rib shadows. It's explaining very clearly. Also, sometimes you will see some people is using what we call the M mode. This is motion mode. So you put a line inside the lung, and it will trace the lung, this line during multiple seconds. This is mostly used during when you're looking for a pneumothorax in emergency situation. They use this a lot to see the lung sliding, etc. It can be very helpful. And also some people, they like to use it in COVID patient because the lungs move much less. There's much less movement because the lung is not functional as much. Yeah. So then if we go down a bit into this document, then we start being into, you know, the saturation in oxygen is less, infection is mild. And here you see the B lines, they're scripted in this document very nicely. You see it's in linear shape. Don't be fooled by the shape of the image. It's a linear transducer that has this, we called trapezoid mode activated, just to have a better field of view. But it started from a linear transducer. This is started from a cardiac transducer, so you can still see your B lines very clearly, no issue there. And this is from a convex, from an abdominal transducer. So they put in this document for all, if you have a transducer, only a cardiac transducer, you will find the result, what it should look like on this document. Then if it's moderate infection, then you see the B lines are more. And then I move down a bit in the document, you see complete consolidation of the lung. Then you even see some spots, bright spots like this. And this section, it's not a very important one, but in some centers they have the, for example, Sequoia system that we have can do fusion with CT. So if we do fusion with CT, then we can correlate even further down. But I would say this is like really overshooting the thing. No need to go that deep. I think they just did it to make sure that the correlation is very good, but it's possible. And when it comes to recovery, then recovery just means that you will start seeing those A line come back. That means the lung has come back to its previous shape. Yeah. So just as a recap, why ultrasound is good for ICU and for bedside scanning with bedridden patients is that you can repeat the scan many times. So if it's an ICU patient, you can re-scan him every hour, see the evolution. There's no problem, no dose, with all different type of transducers, etc. It's very fast and easy to do an exam. And if you want to scan anything else, the kidneys, the liver, spleen, whatever, it's right there. You can do it. So you can cover the whole patient. You can follow up, and usually when it's ICU patients, they cannot move so much. It's very critical patients. It's hard to push them to a CT. If you push them to a CT still, you need to go with multiple people. You need to go with the ventilator. I let you imagine how much of a trouble it can be. So that's why ultrasound really can come as a very useful tool in ICU and in bedridden patient setup. Now I will go very quickly because this is something that is either known or is done by the people who do ultrasound all the time, and they know this already. There is a list of disinfectants that are approved by Siemens on our Siemens machine, and we cross-check those disinfectants with what is called the US Environmental Protection Agency. They just made the list of the disinfectants that are very effective against coronavirus, okay? So we just cross-check, and we made a document that also you can download where we reduce our list of disinfectants to the one that are the most powerful and the most effective against the coronavirus and the SARS-CoV-19. When it comes to protective, the system itself, so here the transducer, doesn't matter the shape of the transducer because usually you can find those sleeves. So this is just like a single-use plastic sleeves that you will cover the transducer with. So instead of disinfecting the transducer, you can protect it. So that's one extra layer of protection that you can find on any kind of transducer. There is also protection for the system. So here you can see, for example, in this ICU setup, you can see there's a silicone cover on the machine, and this is so much easier to clean first, and then if there's any spillage or anything going on the machine, it's protecting the system, electronic components, etc. So it's very good. And I even seen some people use some, you know, those surgical equipment drapes. So it's like complete plastic bags, basically, that you cover the machine with, and you can still use the machine through it by pushing the buttons. That doesn't make a big impact. So you can cover the whole thing. That's why it's easy to protect, easier than a CT. Now, when it comes to helping you, because that's also the most important topic, we have a few things on our machine already installed that allows us to do some remote support. So for example, this exists also for CT, for MRI, etc., but we call it the SRS, which is Smart Remote Services. And that allows Siemens technical team to support for any, if there's a breakdown or if there's any software to install, they can do it remotely, no need to visit the center. And even in ultrasound, we have something that allows us to help the user by taking control of the machine. So this is called the Easy Link, and we can connect to the machine to help. If there's a new joiner who wants to know a few features better, we can help. PEP Connect is something also that is for every modality, for CT, MR, etc. You have a full fleet of videos to help you understand how to use ultrasound system. So this is very useful for beginners or for people who want to have a recap. And it's easy to access because it's online on the internet. No need to have an account. Some videos you can even have them like this by Google. And when it comes to the documents, I told you where to find them. The same platform, instead of ultrasound, can give you all the documents and all the videos where to find information on COVID-19. And there is even a website that we created specifically for COVID-19 pandemic, where you will find all your webinars that we did internally in Siemens with the key experts in different countries. We have this page for ultrasound where you can download the clinical white paper. So the thing I showed you, the poster, this is where you can find it. So this is on the main internet page. A few data about the system that are useful in this situation, and also how to clean the system. So it's a full page that has been designed only for this. So if you're interested, you can find the information there. Yeah. And the last part, really, and this I can only echo my colleagues. We're just so thankful that you're in the front line, and we're all in this together, and you're doing such a big job. So we're here, I would say, almost 24/7. If you need something, we're really behind, and we're trying to go through this tough time with you. So I hope you know that we're here. And I really want to thank you again. So this is the end of my presentation. Now I think we can skip to the Q&A. So CT and ultrasound together, we'll try to answer all your questions as good as possible.
Thank you, Nicholas, for the nice presentation. We have a couple of questions. First question to Connie regarding the CT. Siemens CT scanning machines and protocols are known for low-dose X-ray exposure. Can you please explain how Siemens can produce low-dose CT checks compared to other vendors?
To answer this question, even most of the vendors are having a filter to reduce the unwanted quanta to the patient. So that is called the aluminum wedge filters, where technological name of that filter, where what Siemens done that we actually, I can again share my screen and show that what we have done, we additionally put another filter on the system. So I can just go to that slide and show you that. Is it able to see this, my screen? So here, if you see that additional a bow tie filter, what we have, we are patented one technology called the tin filter. So that will allow us to reduce drastically. Along with the same technology, we are not only limiting this technology only to reduce the dose. Along with that, we have a high power solution where if you reduce the kV, you need the better MAS. So the high power MA technology, where you do the scanning in the low kV mode and increase the MA. So in that way, you can drastically reduce the dose. In terms of MAS, in terms of kV, if you increase 10 kV step like 70 to 80 kV here, if you see, if I increase the dose level here, if you see that 70 to 90 kV, I am increasing the dose exponentially. Like if it is a 2, then it is 2 raised to 2, 4. So if I increase another 10 more kV, so that means 4 raised to 2, 16 times I increase the dose. So what the technology, the Siemens have, we reduce the kV and increase the MAS. So that is the high power MA technology. And every CT scanner in Siemens Go platform, we made it as iterative reconstruction algorithm standard. So our Sapphire algorithm is standard. So whenever you reduce the dose, increase the noise. So that means it is a waste in the image. So what we have done, we standardize every system. Sapphire is a standard in every imaging. So it will reduce the noise from the unwanted quant also. So we are in combination with the tin filter, high power MA, and Sapphire iterative reconstruction algorithm together will help you to reduce the dose drastically. I hope I answered your question.
We can't hear you, doctor. You're muted.
Yeah. Doctor, you're muted actually. You have to unmute. Yeah.
This leads us to the second question, Tony. You know that COVID-19 patients undergo many CT scans for follow-up and follow the case. So please, can you advise how many CT scans we can perform for such patients and still not exceeding the international limit of X-ray exposure?
To answer that question, even it is normally depends upon the patient condition. Actually, sometimes we compromise the dose towards the patient severity of the disease. And most of the countries are limitation. Actually, till now we don't have a limit. Normally we calculate this is for an year, how much the accumulated dose. But now this is a pandemic situation. We don't have any choice. So sometimes we exceed a little bit dose, but at the same time, you see the tin filter and low dose technology, only 1/10 of the standard dose you're using. So that way you can actually, most of the studies are showing that there is a repeated exams of 5 to 6 times in a short period of time. So 6 to 7, it is increasing nowadays. But you can expect at least, including diagnosis, prognosis, therapy, and follow-up, maybe a 5 to 6 times of scanning within the dose limit we can perform.
Okay, thanks, Connie. The next question to Nicholas. According to the ultrasound technique you have explained in examining patients with COVID-19, I think we are partly examining certain portions of the lung. So this raises a question about how much ultrasound is sensitive compared to CT and the plain X-ray.
Okay, so this is a good question. So in the literature nowadays, we can find some comparison which are very good between CT and between ultrasound. That means that they're almost comparable when it comes to findings and when it comes to making diagnosis and finding those lesions, etc. The one I showed in my presentation is the classic technique of scanning the lungs. But of course, you can go with any windows you wish. Some people, they go through almost above the subclavian bone. You can do anything you want basically with ultrasound. Just the recommendation are to go with those 8 different windows, so 4 on each side. But it's really up to the person who's doing because even the lesions, they're on the pleural side, so you don't need to go too deep, etc., to see those clinical findings. Maybe Dr. Mina can also add some details to this question if he's in the call.
Yeah. The question is, which is more sensitive, CT versus ultrasound in diagnosis COVID-19? Dr. Ahmed, for sure,
yes,
CT is for sure CT is more superior than ultrasound in diagnosis COVID-19. But as Nicholas said in the presentation, because of the availability of ultrasound, it's available everywhere, because it's very easy to sterilize the machine, very cheap modality. So it's very easy to be. It's very accessible than CT. But if any doctor wanted to do a research which is better in diagnosis, for sure CT will be superior than ultrasound.
And regarding plain X-ray, Dr. Mina, how much ultrasound is sensitive in comparison to plain X-ray?
As Nicholas said, COVID-19 tends to be very superficial and near to the chest wall. So ultrasound will be sensitive to detect any lesions, especially the A lines and the B lines, and also the seashore appearance of the M mode. All of these signs could be detected and easily to be followed up with the ultrasound. I think ultrasound for follow-up will be better than X-ray, especially you will not do more radiation for your patient, and you can easy to see the prognosis of the P lines while disappearing and the reappearance of the A lines.
Thank you, Dr. Mina, for the answering. Here we come to the end of our webinar. Finally, I would like to thank Siemens and our speakers today, Connie and Nicholas, for the nice presentations, and see you soon, inshallah, in other webinars. Thank you very much. Thank you.